Welcome back to the Anatomy Shoulder Lectures. This is the second in the series looking at the dynamic stabilizers of the shoulder, or more commonly the rotator cuff as they are known. Before we look at the muscles in a little bit more detail, we're just going to look at the glenohumeral joint and the bony articulation. When we're talking about the shoulder joint, normally we're referring to the glenohumeral joint. If I can just share my screen. So here we are back in complete anatomy, and as I said last time, as a student you have access to this, so I'd encourage you to jump into it and try and reproduce some of the things that you're seeing on screen and help remember some of the anatomical terms, the definitions, the functions, the origins, insertions. Everything is stored in there. There's a huge library of information inside complete anatomy, so please dig in as quickly as you can and try and follow what we're doing. So from the image you can see that there are several bursa around the shoulder. Here's an example of one. There's a subacromial bursa. Bursa are basically a fluid-filled sac. The consistency, some people say, is that of egg white, and it's there to provide a bit of cushioning and free-flowing movement between tendons, overlying muscles, and where muscles and bones may sort of coexist. If we take the connective tissue out a little bit, and we'll just go through a layer. So the joint itself, the glenohumeral joint itself, is covered with a loose and baggy capsule. The capsule itself doesn't provide an awful lot of support, though it does thicken at the front, and we'll come back to that shortly. Let me just take away some of the muscles temporarily so we can look at this in a little bit more detail, and let us just take away the connective tissue. So what you can see here is the glenohumeral joint. You'll notice that the humeral head is articulating with the glenoid fossa. Now the glenoid fossa is a remarkably shallow socket. It's a ball and socket joint. It's a synovial ball and socket joint. The humerus is a typical long bone and is articulating proximally with that glenoid fossa that you can see on the right hand side. Now the scapula itself is an irregular bone, as you can see there. So the scapula itself covers the 2nd to 7th ribs and is essentially suspended by muscles, and next week we'll look at the stabilizers of the scapula and show how it's stabilized and held in space. And it is effectively a pseudo joint between the scapula and the ribs underneath. There are 3 angles, 3 borders, and 2 surfaces. So the surfaces are the Infraspinatus fossa and anteriorly the Subscapularis fossa. The borders, the medial and lateral border, and the spinous scap at the top. And just above the spinous scapula is the Supraspinatus fossa, where the supraspinatus muscle lies, which travels through the gap here, the acromial arch, onto the greater tubercle, but we'll come back to that shortly. So you can see that it's a fairly shallow joint which allows for great movement, synovial ball and socket, and there is a labrum, which is a fibrocartilaginous rim which basically just sits in this area here and deepens that socket a little bit, but still allows for flexibility. So the trade-off with the shoulder is that we have great range of movement, but we lack stability. Many people think that it's rather than a consequence of evolution, this is more of an accident in bipedal humans that actually allowed for a more functional limb. The loose capsule surrounds the joint itself. It provides very little stability. There are essentially in there 3, and these are sort of blended with the capsule, 3 anterior ligaments, and also a couple of accessory ligaments that help in the stability. The coracohumeral ligament there sitting over the top, and that actually blends with the long head of the biceps. Like I said before, it's fairly unstable. And actually the most vulnerable position is the policeman's stop position. And these ligaments have very little role really in stability, but they do tighten up towards the end of range, which helps prevent dislocation. So let us go back into the muscles. I'll just remove the triceps there. So this is where we were prior to the end of the last video. And we're just going to look at the dynamic stabilizers in a little bit more detail, and these are the rotator cuff muscles. So around the back there, we were looking at the supraspinatus muscle. Supraspinatus muscle occupies the submedial 2/3 of the supraspinatus fossa, that's its origin, and it passes underneath the acromial arch, and there are bursa under there to protect that. I've taken the bursa out just for now, but they are there to try to cushion that approximation of the supraspinatus and the acromial arch. Quite often that bursa gets inflamed if there is impingement. So the tendon blends with the capsule and inserts at the greater tubercle of the humerus. The role of the supraspinatus is to initiate abduction, and while it does that, and you can see it in action there, I'll just move this around a little bit, you can see it there. I'll leave that running just while I explain a little bit about how it works. So its role is to initiate abduction. After about 20 degrees, the deltoid takes over to complete the movement. Deltoid is a much stronger muscle. But it not only initiates that abduction, it actually creates a sort of bracing of the humerus. And probably the best analogy I can use here is to imagine when you put a foot on a ladder, and it stops the ladder sort of shearing out when you sort of start to load it. And you can see the action there. The humeral head, as it sort of starts to move, actually is pulled down a bit. So if the deltoid was dominant along with the long head of the biceps, they would effectively pull the humeral head up and into the acromion process. So the supraspinatus, apart from initiating abduction, is actually helping pull that humeral head down to move it away from the bony acromial arch above. So it has a sort of triple role, really. Initiates abduction, prevents that shearing, but also braces the humeral head in the shallow glenoid fossa for a little bit more stability, and it does that with all of the rotator cuff muscles. Let's go back to our view here. So there's our supraspinatus muscle. At the front, we have our subscapularis muscle, and the subscapularis sits in the subscapularis fossa. It attaches to the lesser tubercle, as you can see at the front, so that medial lip of the bicipital groove or intertubercular groove. So it's sitting there in the lesser tubercle. In terms of its action, its main job is to medially rotate. You can see the muscle working just in the background there. It's medially rotating, internally rotating the shoulder. It also works to stabilise and resist the shearing forces of the deltoid and biceps long head as well. And this is particularly as the arm is abducted. So its angle of pull is quite strong, relatively speaking, as a rotator cuff when the arm is abducted. The other two muscles of the rotator cuff, which are the infraspinatus and the Teres Minor muscle. So infraspinatus first. Infraspinatus sits in the infraspinatus fossa. It attaches to the greater tubercle, as you can see there, slightly above the Teres Minor attachment. Infraspinatus is a lateral rotator and has a greater role and stability when the arm is abducted, keeping the greater tubercle away from the acromion. So again, it's stopping the action of the long head of the biceps and the deltoid wanting to pull the humeral head up. It's working then to pull it down, stop that shearing force along with the other rotator cuff muscles. And also, as they surround the humeral head, they're pulling the humeral head back into that shallow fossa to improve stability. Teres Minor similarly starts at the upper 2/3 of the lateral border of the scapula and inserts on the greater tubercle but below the infraspinatus. Involved in lateral rotation, but also because it's slightly lower attachment, has a slightly better biomechanical advantage for helping to adduct the arm when it's abducted. So those are the four rotator cuff muscles. People often use the analogy sits. Supraspinatus, Infraspinatus, Subscapularis and Teres Minor. They all work together, and they all work to dynamically stabilize and help improve that stability of the shoulder, especially during motion. So that was the dynamic stabilizers of the rotator cuff muscles of the glenohumeral joint. In the next video, we'll be looking at the scapular stabilizers and taking a broader look at how the shoulder complex as a whole functions.